Earlier, we hang our hat on and have great pride in is the quality of care that we provide. So there certainly are agencies out there that will come in, do our surveys, and will tell us and tell the community that we are providing high quality care. We'll be licensed by the state of Minnesota to provide the care, as well as there are accrediting agencies specific for ambulatory surgery centers that we'll have to meet their rigorous requirements to be certified through as well.
Okay. Okay. And I think, so that must occur after you open, there's a certain period of time where you're doing test cases or something and
Right.
getting certified. And
the difficulty in opening an ambulatory surgery center is there's also always a transition period. So from day one, you have to be able to prove that you can provide quality care before you can be paid for it. So there will be a transition time. But I think one of the things that people are confused by when we talk about accrediting agencies, not everyone understands what that means. So I tell people it's like having the good housekeeping seal of approval for whatever business you're in this case, ambulatory surgery centers.
Yeah, that's a good way to describe it. Okay. How about from a cost-effective standpoint? I think everyone in healthcare is cost-conscious, and we're trying to do our best to drive costs down. Maybe Deb, you could speak to that as far as what you would anticipate the cost factors will be in a surgery center, just in general.
Sure. As you say, everybody is very cost-conscious in healthcare these days. Everyone understands that healthcare is expensive. Sometimes people wonder, I think, why the costs are what they are in hospitals, but when you think about it, we have huge buildings that we have to have available 24 hours a day, 7 days a week, 365 days a year, regardless of whether we have a patient or none. We always need to be at the ready for the emergency room. We always have to be at the ready for all the services that a hospital provides. The difference with an ambulatory surgery center is that we have much less overhead because we can run the building to be specific to what we do there. We're not an emergency room, we're not a lab center, we're a surgery center. And so we have hours that we run and that our costs are then associated with just those hours.
Sure.
So it's just plain economics that our costs overall are less because we're not there as the safety net for the community. We're there to provide the service of surgery.
Sure, that makes complete sense. Okay. So it is a facility that is, I think, Monday through Friday, basically, and
Right.
Okay. Okay. Good. Makes a lot of sense. How about electronic medical records, health records? It seems like that's a big issue as well within healthcare, and everyone's moving towards that. Dr. Sundell, can you speak to that? Do you anticipate having that kind of a technology?
We certainly do.
Okay.
Yeah. And currently I have an electronic health record and practice management software in my clinic, and have had electronic records probably dating back to the 90s, in the late 90s. So I'm very familiar with electronic health records, and there's really no option of not having them anymore. I mean, the government's mandating that. And they do help increase efficiency in a lot of ways and make things more standardized, very easy to track case volume, financial information, surgical data that is surgeon specific, patient outcome data that the government needs. And so we definitely will be electronic there.
Okay, good. Go back to something you said, Deb.
Yes.
You mentioned technology a little bit ago. How much of a factor has technology played in the development of surgery centers? Or you mentioned with regards to length of stay. I mean, is the technology advancement a big factor in that regard?
Hugely.
Okay.
Again, if you think about in my lifetime, we didn't have surgeries that you did through scopes. Everything was an open surgery, and people were debilitated for quite a long time. Well, now with the advances in technology, some of these are minimally invasive, where basically you have a couple stitches and a couple of Band-Aids, and that's your scar. So certainly it has made a huge role. The technology is expensive, but the trade-off to that has been better patient care and better patient rehab. People return to their jobs more quickly, they return to their regular life more quickly, and in some cases the quality actually is better. Certainly electronic records is the tail end of that, but the technology up front of how we take care of people. Think about a cell phone, for example, would be a great example. You know, I'm old enough where I remember corded wall phones, and that's what you had for a phone. But now your phone is everything. It's your computer, it's your access to the internet. It can do many more things. It's the same type of rapid technology in healthcare.
Interesting. So, Dr. Sundell, have you seen that in your own practice? I mean, the advancement of technology and that's effect on patient care at all?
Absolutely. Ophthalmology is an extremely progressive surgical subspecialty with new things coming out all the time.
Mm-hmm.
And so operating in an ambulatory surgery center allows you to adopt newer surgical techniques very rapidly.
My mom was a surgical nurse, and I remember her talking about, obviously this is quite a while ago, when people would come in for cataract surgery, they would lay for days or hours flat on their back with sandbags on the side of their head where they couldn't even move.
Yeah.
Well, now, someone who's in your morning schedule having a cataract surgery, you're likely to see them at the local cafe at noon.
Mm-hmm.
Right.
So it's quite different.
Yeah, it's amazing.
It is
the
amazing.
changes that occurred. Wow.
That's before my lifetime, but I hear my patients talk about it. It's really fun.
Yeah.
Right.
Well, the surgery center sounds like it's going to be a great addition to healthcare in northern Minnesota. And Northwoods Surgery Center is the name, I believe.
Yes.
And so you're talking about opening in May or June, somewhere in that neighborhood of this spring. Weather hopefully will cooperate and allow that to happen. Well, it's been very interesting talking about the surgery center, and hopefully those watching today have enjoyed hearing about it. And I think, no doubt, there'll be more to come, more things to be to learn about the surgery center, and probably more things in the papers and so forth as we get closer to actually opening up the surgery center. So, thank you both for joining us today.
You're welcome.
My
Your
pleasure.
Range focus. So it was fun to talk about the surgery center, and it's great to hear about the economic impact and the value it's going to have to healthcare on the range. So it's wonderful. Thank you both.
You're
Bet.
welcome.
So that concludes our program for today. So I hope you'll look forward to other events in our monthly schedule. And if you want to learn more about what you heard today or more about Fairview Range, you can check out our internet site, which is www.range.fairview.org. Thanks for joining us today. Be well. Thanks for watching.